So we're going to go into connective tissue here and kind of talk over some of the general characteristics of it and some of the different things that make up connective tissue, and then there's also the types of connective tissues and the membranes. So connective tissue has a lot of different functions to it. Some of the main functions we end up finding is it ends up becoming both metabolic and a structural connection. So your metabolic will be things like your blood is a metabolic connection, a connective tissue. Structural would be things like tendons, ligaments, but also bones, cartilage. All these end up being structural connections there that they make between tissues. Protective sheaths around organs, so they go around the heart, the lungs, the intestines, the reproductive tract. They also make sheaths for like the joint space. Insulation for the body in the form of adipose to conserve energy there. Also, adipose is a reserve of energy for the body. Framework for support of the body. So once again, you're going to your bones, your tendons, your ligaments, but also connective tissue makes up the framework for all the organs in the body. So it actually gives support to the things like the liver, the heart, the lungs. Medium for transporting substances from one region of the body to the other. So this is what blood does, and blood is a connective tissue, and then plays a very important role in the healing process and controlling invading microorganisms. If we were to put out the four types of tissue, connective tissue is the most abundant tissue by weight. So it weighs more than all the epithelium in your body, all the nervous tissue, and all the muscle tissue, if you were to look at them each individually. Unlike epithelium, connective tissue is very highly vascularized. One reason for this is blood's a connective tissue, and so the reason why it ends up being so vascularized is all the blood flow that's in connective tissue, because blood is a connective tissue, so they kind of stick together there. We find three distinct components. We have the cellular component, which is going to be things like fibroblasts, chondroblasts, osteoblasts. Also, we can call those sites, so chondrocytes, fibrocytes, osteocytes. But also when we look at bloods, it's red blood cells, white blood cells. And then we have ground substance and extracellular fibers. Extracellular fibers are going to be things such as collagen, elastin, fibrin. Those are the main ones we find. Also, there can be some proteins that can also be in those extracellular fibers. Ground substance is going to be more of a homogeneous looking type of amorphous liquid portion of connective tissue. So this is actually a lot of your interstitial fluid around the cells. You've got some hyaluronic acid, some proteins, some electrolytes all put in there together that make up ground substance. But ground substance can also be things like the bone matrix, cartilage matrix. So there's a lot of different things that will make up ground substance. Examples of connective tissue are things like blood, tendon, fat, cartilage, and bone. So ground substance is the medium in which the cells exchange nutrients and waste with the blood. It's amorphous, it's a homogeneous material. It's got a lot of what we call glycoproteins in it. It actually helps to surround the cells and actually gives them protection and a medium for things to once again move back and forth. But then it's also a very important obstacle for keeping microorganisms that get past barriers like mucous membranes in the skin. They happen to penetrate those, and it's a way that they can actually get trapped within the ground substance, and it allows the body's white blood cells a chance to get rid of them. Extracellular fibers, so the main ones here are going to be things like collagen fibers, which are collagenous. They're very strong, very thick. A lot of times when we look at these fibers, one of the interesting things about them is they really don't stretch or give that much. They can bend, but they don't really stretch. They're organized into bundles, so almost like making a cable or something, or a piece of yarn or rope. They're kind of woven around each other. They do have varying densities and arrangements in the way that they're put. So they can be woven. They can also be weaved together, kind of almost like trying to weave together fabric. So just depending on which tissues is the way that we have them. They go around organs. They make up tendons and ligaments. They connect a lot of things together that need to be tightly bound in the body. Reticular fibers are also made of collagen, but they're not nearly as dense as the collagenous fibers, and so they kind of make a thinner, more delicate network. The main thing that they're about is actually giving a place for cells to connect. So they actually give organ shapes. They give a place for the organs to actually put their cells onto and actually have them arranged. And that's what these fibers do, is they just kind of arrange everything in there. So they end up making up things like the liver, the endocrine glands, the lymph nodes, the spleen, bone marrow, liver, but even the heart, the lungs, the brain, we all have reticular fibers in those areas. They also help to form nerves, so they actually kind of help bound the individual nerve cells together to actually make a nerve where you have a whole bundle of nerve cells right there. They also help to give shape to things like blood vessels. They also give a place for muscle fibers to attach to and help to form the capillary beds. Lastly, we have elastic fibers, and elastic fibers actually stretch, and they're going to be any place in the body where we're going to actually stretch. So collagen fibers do not stretch, elastic fibers do. A lot of people always get confused. They want to put elastic fibers into tendons and ligaments. Elastic fibers are not in tendons and ligaments. If there are, they're in a very, very small amount, because these things stretch. And if you were to put them in a tendon or ligament, then it would actually make a joint unstable. Or the other thing it would do is muscles actually wouldn't move, because when the muscle, or limbs, I should say, would not move, because when the muscle actually would go to contract, then what would end up happening is it would actually just stretch the elastic fiber and not actually cause the limb to move. It would just move the elastic fibers. But instead, elastic fibers are going to be found in places like my vocal cords, where I'm talking right now, because it needs to stretch. The bladder, the hollow organs like the stomach and the intestines, the esophagus. So these areas that would stretch like that. Also the reproductive tract. So like the uterus, that would need to stretch during pregnancy. They're kind of a coiled microfibril, so when we end up looking at them, they're actually, what makes them stretch is they're coiled. So if you look at collagen, they're not coiled, they're straight in the way that they're made molecularly. But when you look at the molecules here for elastin, they actually coil, and that coil is what actually gives it stretch. When we start looking at cell types and we start looking at connective tissue, we have fixed cells. So these are going to be fibroblasts, chondroblasts, osteoblasts. All these I've already said before, osteocytes. And then, of course, if we end up saying things like a cyte, then blast is the young form, cyte is the more mature form. Fat cells are in here, and so these don't actually leave where they're living at. They're either fixed into one spot, or they're going to be within a certain region, like a fibroblast. A lot of these will actually live in one specific region. They might migrate in case of an injury, but they're not going to go very far. If a fibroblast is in your arm, it's staying in your arm, and it's staying within a very small area there if it has to move. When we look at transient cells, these actually move across the whole body. And the big thing that makes transient cells, well, they're going to be blood cells. So the examples I give here are leukocytes, mast cells, and macrophages, and red blood cells. So these actually have the ability to leave one part of the body and travel, say, out of your arm and actually travel to your leg. And that's what makes them transient, is they're able to move all over the body. When we're looking at connective tissue, we have proper connective tissue, and then we have specialized connective tissue. Looking at proper connective tissue, we have three different categories. We have loose connective tissue. This is going to be areolar connective tissue, adipose connective tissue, and reticular connective tissue. Then we have dense connective tissue. So we have dense regular tissue and dense irregular tissue. And then we have elastic tissue. So starting off with areolar here, the connective tissues, this is very loosely arranged, and I do have a picture right over here showing you. And so this would be collagen fiber and a collagen fiber here and a collagen fiber here, and it's just very kind of loosely. There's a lot of space in here. There's a lot of ground substance. We're seeing some different cells in their nuclei. And so they're just kind of randomly tangled together. And we find this throughout the body, where we're just needing to make loose connections between cells and have some interstitial space there. The main cell living here that actually supports this is going to be the fibroblasts, because they're actually going to sit there and make these collagen fibers and maintain them. But it's just kind of a random loose tangle right here. And pretty much its thing is actually to kind of surround some of the cells, give a support to the ground substance matrix that's in between here, and allow nutrients to pass through. We find this below all of our mucous membranes in the body. And this is the area that's really easy to get edemas, in the areolar connective tissue. Next, we have adipose, which is fat. The cells are actually packed in here fairly tightly, but if we were to actually sit there and stain these, what you actually find out is underneath the microscope slide, it looks very loose, because you can kind of see where the outline of the cell membranes are, and you don't see anything in the middle. It's probably not the best artist rendition. If you could actually turn this more like pink underneath the stain, you would see this white area would be pink, and where it's kind of yellow in here would actually just be clear. And a lot of times on a microscope slide, it's very easy to lose where you're looking at adipose tissue. It doesn't stain the best, because all of our stains have a polar charge to them, and fat or lipids have no charge. So most of our stains are made up of cations or anions, and they're looking for something to bind to the stain. And of course, lipids in here have no charge, and they actually repel the stain, so that's why it looks really loose and hardly like anything's there. It's very vascularized when we do look at adipose tissue. We have two types. We have white adipose and brown adipose. So brown adipose is found in neonates, and it will be found in animals that hibernate. And the main thing to know about it is it actually produces body heat, and is an energy source to maintain a normal body temperature. What happens in most mammals, including us, or even dogs and cats and horses, is we're born with this brown adipose, but this brown adipose ends up being converted to white adipose. And white adipose does not actually produce any body heat and does not burn off. It actually is there as a storage. So it's there to store extra energy in the form of lipids. It also stores things like vitamin A, vitamin D, vitamin E, and vitamin K, which are the fat-soluble vitamins. They all will be stored in adipose. It is a thermal insulator. Both brown and white both give insulation to the body. And then white adipose is also a major shock absorber to help protect the body from injury. Reticular connective tissue. This is a loose connective tissue. This will be found in the organs, and these are very loosely arranged reticular fibers again. A little bit denser than what areolar is like, but not nearly as dense as when we get into the dense connective tissues next. Once again, you've got fibroblasts in the inside of a ground substance here, matrix. This right here would be a picture of the spleen, and all these cells out here are red blood cells, and then what you're seeing in the black would actually be your reticular connective tissue that's actually going to allow macrophages to actually grab on and hold on, so where they can actually sit there and go through and clean anything that comes in the spleen, ends up cleaning out any type of foreign invaders or damaged red blood cells. And so that's what they're showing here, is the way that those reticular fibers would be lined up to give that support inside and a place for the cells to attach to inside of an organ. And so we call that framework the stroma, and so they end up making the stroma. Next, we move on to our dense connective tissues. And so we have dense regular, dense irregular, and elastic. So starting off with dense regular, we call it dense regular because all of the fibers run in a regular direction, or one direction. So this right here would be a tendon, and you can see how all these collagen fibers are lining up. All these lines are going in the same direction. And you can see here we have the nuclei of the fibroblasts out here. And what dense regular connective tissue ends up making is tendons and ligaments. It doesn't stretch. It's very, very tight. It will bend, but it does not actually physically stretch. And so it's very good for actually connecting muscles to bone to allow for movement, because you want it to where it's like a cable that's trying to move something at a distance. You can hook up like a winch with a cable if you want to move a vehicle and you have that winch stationary, and all at once when you engage it with that steel cable, it's going to drag that vehicle back to it, like off if you're trying to bring something up on a tow truck or something. Well, that's what these do, is these are actually woven together kind of like that steel cable, and they don't stretch or give like that steel cable, and they attach that muscle, that bone, and they actually create motion or movement. Most connective tissue has a lot of vascular blood flow, but these are actually pretty much avascular. So there's not very much blood flow that actually goes inside of a tendon or ligament. It actually takes them a bit longer to heal. There's actually way more blood flow in something like bone than you'll ever find within dense regular connective tissue. Dense irregular connective tissue, on the other hand, is highly vascular. And the main thing to look at these fibers right here is they all are running in a different direction. So whereas up here on this page, you can see they're all running in one direction, dense irregular, they run in many different directions. And so our area that we find this most often is going to be like in the dermis. So when we look at the dermis right here, we're going to find this dense irregular connective tissue. And it makes it really thick and tough and strong. We also find it on capsules around certain organs. That makes it really dense, tough, and strong around them. And this is almost woven together like you're trying to use yarn or a cable. This is weaved. So this is actually weaving right here. This is weaved together to make it super tough. That's the key difference between dense regular and dense irregular. They both don't give. These collagen fibers, once again, they bend, but they do not stretch. And so they make a very tight, thick capsule around things. Lastly, we have elastic connective tissue, and they don't have a picture of it up, but they can be parallel fibers or they can be interwoven. The main thing to know is that, once again, they're actually going to sit there and stretch. So locations we find them, they're actually part of some of the cartilage in between vertebrae that actually allow you to have that flexibility to your spine, because there is some stretching that they allow to happen. They're also going to be found in certain areas of the body, not really in ligaments. So that's one thing I don't really like, is they have ligaments up here, but it's going to be found more like in the walls of your blood vessels, like arteries, or inside of your GI tract, like stomachs and your intestines. In your lungs, things like your bronchi and actually your lung tissue that needs to expand, your vocal cords, your bladder, your heart. All these areas that actually change in size and stretch out and contract back down will have elastic connective tissue. Lastly, we get to the third category, which is specialized connective tissue, and we have cartilage in here, and there's three types of cartilages. We'll talk about bone, and then lastly blood. So cartilage is more dense than dense connective tissue, but it's also more flexible than bone. So it's actually more rigid and dense than our dense connective tissues are, but it's not nearly as dense as bone. However, it's way more flexible than bone. Once again, like dense regular connective tissue, it's avascular. It's also aneural, so there's actually no nerves within cartilage itself. Living inside of cartilage is a chondrocyte. They actually live in these little specules that we call lacunae, and they're there to actually maintain the health of that cartilage and make more of the matrix if needed. The matrix is made up of a ground substance, and that ground substance has a particular name to it called polysulfadic glycosaminoglycan. And the thing about it is it actually sits there and helps to keep moisture in, and moisture is very key for the health of cartilage. To actually keep hydrated cartilage is actually healthy. So there's a lot of fluid in there, and then you do have some collagen fibers and some different elastic fibers that are mixed in there too. Locations are joints at the end of bones, the ear, the nose, the vocal cords, part of your respiratory tract like your bronchi and your trachea. You're going to find cartilage in all those. Plus, all your bones were originally actually formed from cartilage. Hyaline cartilage is the most common throughout the body and the most abundant form of cartilage. It's the most rigid form of cartilage. It's composed of tightly packed collagen fibers, and it has all those polysulfadic glycosaminoglycans spread throughout that make up that ground matrix in there. And these are packed so tight that it makes it really thick and dense. And then on the outside of cartilage, we have something called the perichondrium that actually kind of encapsulates it. So this makes up the early skeleton, and it actually will make up your growth plates. You can find it in things like tracheal rings and on the end of all of your long bones and all your major joints in your axial or your appendicular skeleton, so like your arms and your legs. And then it's there actually to connect the ribs to the sternum on the center of your chest. Elastic cartilage, this is actually really important for being flexible, and you're going to find it like in your ear or your nose. It can also be found on your epiglottis and part of your larynx. So part of your larynx is hyaline cartilage, and it's rigid, and it makes a certain space, but other parts like where your vocal cords or your epiglottis where you have movement, it's actually made up of elastic cartilage. Interesting thing about elastic cartilage in ears of humans is it actually continuously grows throughout your life. So a little bit of an interesting thing, and so does the elastic cartilage in your nose. So your nose and your ears do continuously grow a little bit every year. And you can kind of see this is a lacunae where you'd have a chondrocyte in here, and then you actually have your elastic cartilage out here, and it's actually got elastic fibers in it to give it that stretch. Lastly, we get the fibrocartilage. So this is going to be found between vertebrae in the spine. So it makes the cartilage a little bit more flexible for some of the bending and things, and also is really good at holding the vertebrae together. It's also going to be found in young animals in between bones in their skull. So when we look at the skull bones, you'll see all the different ones, like your occipital and your parietal and your facial and incisive and maxilla and mandible. And so a lot of these joints in between these are actually made up of fibrocartilage, and these will eventually, we call them suture lines, eventually when the animal fully matures, these suture lines go away and the fibrocartilage is actually converted into bone. It also is there in the young and the pelvis, and it does the same thing. The pelvis is made up of actually multiple bone segments, and eventually they actually all fuse together through fibrocartilage. Bone is the hardest and most rigid of all connective tissues. It has what we call these Havershan systems, so these round systems right here. And in the center is what we call a Havershan canal or a central canal. And so these are important because right here in the center we have blood vessels and nerves and lymphatic vessels that run through here. And coming off of these canals are going to be these little lines that you see, but they're just not lines. These are capillaries, and these are called colliculi. So this is where blood actually goes out into bone. And then living out here, and these little black specules we see, we call them lacunae, are actually osteocytes. So actually cells that keep this bone matrix, this mineral matrix out here alive and viable. And these cells are actually kind of interesting. They look like they're really small, but they're like really long, and they actually branch out more like a tree. They're not these like we usually see in a picture where they're these perfectly square or round cells. These actually have a really interesting three-dimensional shape in there. And so bone is actually very live and dynamic. You have the mineral portion, but you actually have a lot of reticular fibers in here that actually give a place for these mineral matrix, all this calcium to actually attach to help make up the bone. So it's both got a lot of organic collagen fibers in here, and then we have those inorganic calcium salts. It is highly vascularized. It's highly innervated. So each one of these big canals have got a vein, artery, and nerve all running through them. So you can see how much. So it's way more vascularized than what cartilage is. And actually, if you get blood growing into cartilage, those chondrocytes that live in cartilage actually turn into osteocytes. So how we actually convert and how our body actually goes from making cartilage as a skeleton to bone is we actually introduce blood and oxygen to cartilage, and it actually converts to bone. So it's very, very heavily vascularized and has a lot of nerves in it. Lastly, we get the blood, and so the ground substance of blood is plasma. The fibrous component is protein, and then we actually have fibrinogen. So we've talked about collagen and elastin, but we have fibrinogen that's here in the bloodstream that's kind of related to collagen and elastin. The main thing it does is if you end up having some type of injury to a blood vessel and blood starts leaking out, the platelets are activated, and the platelets activate those fibrin cells that make up the fibrous component here, and they actually help to form the blood clot to stop bleeding. So you're going to have erythrocytes, which are red blood cells. You're going to have leukocytes that are white blood cells, and then you're going to have thrombocytes, which are your platelets, all living within blood.